Alflorex has a proven efficiency in treating an irritable bowel syndrome, including bloating and gases, abdominal pain, diarrhea, and constipation. It contains the unique bifidobacterium longum strain, which has been clinically proven to reduce typical irritable bowel syndrome symptoms. It works by binding to the epithelial cells and mucus in the intestinal wall, and forms a softening and protective layer that enhances and strengthens the intestinal barrier. Instructions for use. Take 1 capsule per day with or without food at any time during the day. Take Alflorex within your lifestyle routine, whenever it is easy to remember its daily intake, breakfast, lunch, or dinner. Take for 1 month in order to prepare the intestine and continue its use daily to maintain the effect. Dietary supplements should not replace a balanced and or healthy diet. How quickly does Alflorex work? Alflorex acts immediately and begins to prime your gut where it is needed. This activity takes approximately 4 weeks, and during this time, it is important to take Alflorex every day and finish the full course. Some people may experience mild and temporary changes in their gut during the first 4 weeks, as Alflorex begins to gently prime the gut. How long should I take Alflorex for, and what happens if I stop? Alflorex stays in your gut for as long as you continue to take it. It performs its action in the gut and then will naturally be swept out by regular bowel movements. By taking a single capsule of Alflorex every day, you can ensure your gut remains primed. Can I take Alflorex with antibiotics? As happens with most bacterial cultures, a dose of antibiotics could inactivate the bacterial culture in Alflorex. If you have to take a course of antibiotics, we advise you to take the dose of the antibiotic at a different time to your daily dose of Alflorex.